Hi, my name is Dr. Rasha Ali. I'm a comprehensive ophthalmologist and cornea subspecialist. A cataract is a clouding of the natural crystalline lens in the eye. Just like you have lenses in your glasses, you have lenses in your eyes, and they sit behind the colored part of your eye or your iris. So when you're born, for the majority of people, their lenses are clear. But as we get older, they become cloudier because they build up proteins and other byproducts. And when they get cloudy, it's like looking through a dirty lens, making it hard for you to see. So sometimes people don't notice that a cataract has caused their vision to decline. And the reason being is that the progression is very slow. So if you were to imagine a frog being placed in a pan of warming or boiling water, the frog may not necessarily notice the change in temperature until it reaches a critical mass. And the same way, you may not notice a change in your vision due to a cataract until your vision drops beyond a certain point. Why is it important to diagnose cataracts? Well, in some cases, early screening for cataracts can prevent you from having difficulty with nighttime driving, potentially cause risk of accidents if you don't get your vision checked on a regular basis. It's important to do regular eye exams, not just to evaluate for cataracts, but to make sure you don't have any other vision-threatening diseases such as glaucoma or macular degeneration. Early screening for these diseases can prevent them from progressing. If you detect a cataract earlier rather than later, your quality of life will be significantly improved. So how to prepare for surgery? Typically, the best way to prepare for surgery is to make sure that the surface of your eye is in good health. If you have conditions like dry eyes or blepharitis, we can work together to make sure that they are adequately treated so you have a healthy front surface of the eye and you have a good chance of smooth post-operative recovery. So there are multiple kinds of cataracts. There's something called a nuclear cataract, which is typically a slow-growing cataract. That one will decrease the quality of your vision slowly over time. There's something called a posterior subcapsular cataract. This is typically a fast-growing cataract, and you'll notice a rapid decline in your vision. There's another type of a cataract called a cortical cataract, and this one looks like spokes in a bicycle wheel. Due to the way the spokes are oriented, with this type of cataract, you may experience significant glare or halos when light hits your eyes at night. So the question then becomes, once we remove your cataract, what next? Well, in order for you to see better, we can't just take out a lens and not put anything back in, so we would put a replacement lens in your eye. There are now a wide variety of intraocular lens implants available. And the question becomes, which lens implant is the right option for you? Traditional insurance covers what's called a monofocal lens. This lens will allow you to see at a fixed target, either at distance or at near. It does not give you a range of visions. So in your glasses, typically you have two parts of your prescription. One is something called the power, and the other is called the astigmatism. Not everybody has astigmatism, but for those who do, it's related to an abnormal curvature of the front part of your eyeball or your cornea. Your glasses prescription is designed to neutralize this astigmatism. We can neutralize this astigmatism in surgery as well, either with a specialty lens or with laser correcting incisions to treat the astigmatism. Based on our in-office discussion, we can decide which option is the best option for you. Typically, you'll be seen a day after surgery, a week or two after surgery, and a month after surgery. And it's critically important to make sure that you have the appropriate ride to take you to and from surgery and to clinic as needed. If you want to be able to see distance, computer vision, and up close, please come in to have a more detailed discussion about what multifocal lens options would be the best fit for you. What are restrictions after cataract surgery? So for the first 3 days, patients are typically instructed not to drive per the discretion of their doctor, including the day of surgery. We also advise patients not to lift anything heavier than a gallon of milk or bend at the waist for the first 7 days following surgery. We also like to see our patients for post-operative appointments. So we ask that you remain in town for 1 month following cataract surgery to maintain your scheduled visits. If you think you may be having symptoms that could be related to a cataract, We have a cataract self-test questionnaire on our website. Please feel free to take a look and answer the questions. And if you think you may be experiencing blurry vision due to cataracts, we'd be happy to see you in clinic.